Good morning. I am Brady Hamilton from the National Center for Health Statistics, and I will be speaking about the general trends in childbirth in the United States, which hopefully will provide a context for the presentations that follow. Here we go. I would like to acknowledge and thank my co-author and colleague, Joyce Martin, for the help on this presentation, as well as several of my other colleagues whose work I will be highlighting in this presentation: Michelle Osterman, Elizabeth Wilson, Stephanie Ventura, and Sharon Kermeyer. Before I begin, I would like to note that the data presented in this talk were obtained from the birth certificates of residents in all U.S. states and the District of Columbia for each year, which is effectively a universal count of all births that occur in the United States. Let's first look at the general demographic trends in childbirth for a few select items. The overall trend in the number of births in the United States has been rising for the last 9 decades, up to 3.95 million in 2011, although there have been several periods of decline as recently as the last few years. The general trend is a product of the increasing size of the U.S. population, specifically the female population of reproductive age, as well as the fertility patterns, which I will address shortly. While generally rising over the long term, as I noted, the trend in the number of births has fluctuated considerably over time. For instance, births have declined during the 1920s through the 1930s, the 1960s through the 1970s, in the early 1990s, and over the last few years. I went ahead a little bit too far, thanks. Looking now at the distribution of births by population group, in 2011, the majority of births were to non-Hispanic white women, over 2 million, followed by Hispanics, the second largest group, slightly less than 1 million, and non-Hispanic black women, almost 600,000. These 3 groups are the 3 largest race and Hispanic origin groups in the U.S. by population size, as well as the number of births. Rounding this off, births to non-Hispanic American Indian or Alaskan Native and non-Hispanic Asian or Pacific Islanders, not shown here, accounted for about 45,000 and 250,000 births in 2011. The number and percentage of births to groups other than non-Hispanic whites have been increasing over the last few decades, as has births to parents of different races and ethnicities. In 2010, slightly more than 2% of U.S. births were to women who reported more than one race, that is, multiracial mothers. As I noted, the number of births is a product of the size of the population, specifically the number of females of reproductive age, as well as fertility patterns. To assess fertility patterns, we can use measures such as the total fertility rate, shown here for 2011, which estimates the number of births that a group of 1,000 women would have over their lifetime based on the birth rates by age of the mother in a given year. This rate can also be expressed as the expected number of births per woman, as shown here. Now, generally, the trend in the total fertility rate has followed the trend in the number of births. I had to pull this slide out in order to save some time, but bear with me for a minute. However, the rate has been fairly stable over the last 3 decades, ranging between 1.8 and 2.1 births per woman from 1980 to 2001. In 2011, the average number of expected births per woman differed markedly by race and ethnicity, as seen here, with Hispanic women having the highest rate and American Indian and Asian or Pacific Islander women having the lowest. Taking a moment to look at the specific birth rates by age of mother, we see markedly different and interesting trends in these rates over the last 2 decades. The most noticeable trend is that the rates for women under age 30 have generally declined, while the rates for women age 30 or more have risen. This slide shows the percentage of births by age of mom for the latest year. In 2011, as we see that 40% of births were to women aged 30 or over. This is up from 20% in 1980. The impact of the long-term shift in births to older moms is evident in the mean age or average age of mother. The overall trend in the age has been rising, both for all births and births to first-time mothers. The mean age at first birth increased from 21.4 in 1970 to 25.4 in 2010, a difference of 4 years. Let's now look at the general maternity and infant health trends for a few selected items. Births by cesarean delivery increased from 1996 to 2009, but that trend appears to have abated as the rate declined slightly from 2009 to 2010 and was unchanged from 2010 to 2011. Cesarean deliveries for non-Hispanic white, non-Hispanic black, and Hispanic women likewise increased from 1996 to 2009. Since 2009, cesarean deliveries have leveled off for non-Hispanic black and non-Hispanic white women. As you see here, non-Hispanic black mothers are more likely than other women to have a cesarean delivery. Cesarean deliveries have increased for all age groups during the same period as well, but have also recently declined slightly, although they are still well above the 1996 level. Preterm birth rates shown here, which had been on the rise, peaking in 2006, have now declined for 5 straight years, down by 8% from 2006 to 2011. However, the rate in 2011, while the lowest in more than a decade, is still higher than the rates during the 1980s and most of the 1990s. Preterm birth rates have declined significantly for infants in each of the 3 largest race and ethnic groups since 2006. Despite the declines for all groups, disparities persist. The rate for non-Hispanic black infants in 2011 was 60% higher than the rate for non-Hispanic white infants. In terms of the distribution of births by gestational age, there have been major shifts over the last 2 decades. First, from 1990 to 2006, the overall distribution shifted to earlier gestations as the proportion of births at 36 to 39 completed weeks of gestation increased. Second, from 2006 to 2011, we see a shift towards longer gestational ages, with more births occurring at 39 and more weeks and fewer at less than 39 weeks. Another way of looking at this shift in gestational age is illustrated in this slide. Okay. Taking a brief look at births from 37 to 40 weeks of gestation, the percentage of births at 37, 38, and 39 completed weeks of gestation increased from the 1980s through the mid-2000s, while the percentage of births at 40 weeks of gestation declined. However, starting in 2006 and continuing to 2011, the percentage of births at 37 and 38 weeks declined, while the percentage of births at 39 weeks rose at a faster rate, and the percentage of births at 40 weeks increased slightly. Turning now to low birth weight, the percentage of infants born weighing less than 2,500 grams increased from the mid-1980s through 2006, up by more than 20%, but the rate has declined slightly since then, down by 2% from 2006 to 2011. As with the preterm birth rate, there is a considerable range in the low birth rate rates by race and ethnicity. The rate for non-Hispanic black infants, the highest, is more than 2 times higher than the rate for non-Hispanic white infants, the lowest. This slide shows weight gain during pregnancy. The percentage of women who gained more than 40 pounds or less than 16 pounds, that is, more than the recommended amount of weight gain during pregnancy or less than the recommended amount of weight gain during pregnancy, have increased over the last 2 decades. with the percent who gained more than 40 pounds increasing by more than 50%, and those who gained less than 16 pounds nearly doubling from 1990 to 2010. Looking briefly at two other maternal health items, we see here gestational diabetes rates, and in the next slide, gestational hypertension rates, both of which vary considerably by race and ethnicity of mother. The highest rates for gestational diabetes among the selected groups shown is that of non-Hispanic Asian women, while the rate for non-Hispanic whites, non-Hispanic Black, and Hispanic women are much lower and do not differ by that much in comparison. Here we go. Among these same groups, non-Hispanic Black women are more likely to have gestational hypertension, while non-Hispanic Asian women are the least likely. Here we go. Turning now to twin births, we see that both the number and rate have been rising until very recently. The rate increased 76% from 1980 to 2009, rising by nearly 3% a year during the 1990s, but only by less than 1% during the mid-2000s. The number of births and twin deliveries doubled from 68,000 to 137,000 over the last 3 decades between 1980 and 2009. In 2010, however, for the first time in several decades, both the number and rate of twins declined slightly. The rise in the number and rate of triplet and higher order births during the 1980s and most of the 1990s was even more dramatic, with the rate increasing by more than 400% during that time. Since peaking in 1998, the rate has declined 29%. 2010, there was 5,503 births in triplet and higher order deliveries, the lowest number since 1995. To summarize, there have been substantial increases in the number and percentage of births to groups other than non-Hispanic white, particularly Hispanic women, and to women aged 30 and over. And women with excessive weight gain have also increased. There has been a slight decrease as well in the cesarean and low birth rate rates following years of increase, and there has been a longer and more sustained decrease in preterm rates. As I noted, marked disparities in these rates among racial and ethnic groups persist. Finally, let's get through these. Finally, the rise in the twin birth rate may have halted. The triplet and higher order rates clearly appear to be declining. And finally, in closing, I want to mention the new items on the birth certificate, which we expect to release within the next few months. Listed here are several of the new items. As you can see, they span several very interesting and important topics and include body mass index, tobacco use and quitting prior to pregnancy, source of payment for the delivery, intervals since last live birth, and so on. My colleagues and I are looking forward to releasing these data soon. With that, my colleague Marian McDormand will now speak on women giving birth in various settings.
So that wonderful presentation will be followed by Dr. Marian McDormand's presentation. She's a senior statistician and researcher in the Reproductive Statistics Branch at NCHS Centers for Disease Control and Prevention, and her research interests have included home and out-of-hospital birth, C-sections, induction of labor, preterm birth, and so on. And her topic today is who are the women giving birth in various settings. Dr. McDormand.